I'm going to start. So this is, like I said, we're going to talk about vaginal discharge and is it a yeast infection? This is a little bit about me. I think our admin has already given us a very detailed introduction. Right, so now let's talk about the types of vaginal discharge before I go into the yeast infection per se. Now, sometimes, actually most of the time, patients are worried whether or not a change in the color of the vaginal discharge is normal or abnormal, or is it part of our cycle? So now, certain kind of vaginal discharge that we normally see in our gynecological clinics is like the first one is the clear vaginal discharge. Now, this one is usually transparent, sometimes sticky, it's odorless, and just before or at the ovulation, which means day 14 onwards, you may have this type of a discharge, and there's nothing to worry about here. It happens a lot in pregnancy as well because of the hormonal changes. Now, a white vaginal discharge, the second point over here, this is a few type of white vaginal discharge. One of it is the yeast infection, but not all white vaginal discharge are yeast infections. And also the red vaginal discharge, of course, there's menstrual discharge. And if at all, anyone does have, you do notice having red vaginal discharge after intercourse, then that could be an alarming sign. It could be, it not necessarily is, that it could be bleeding from the cervix. So you can always consult your gynecologist and always check whether, if you had a pap smear done at least at least a year before, and that's normal, then you can always consult and they can take a look whether the cervix looks abnormal or normal. Gray vaginal discharge, this is very typical of bacterial vaginosis. So after I touch on the yeast infection, then I'll be touching on just a bit on vaginosis. Yellow and green discharge usually are linked to STDs, which are sexually transmitted diseases. And pink vaginal discharge, this can be, for example, after missing your periods, you do have some pink vaginal discharge that's usually not period. It could be an implantation bleed or any trauma to the cervix. Okay, so now, like I said, now not all vaginal discharge is abnormal. So now, first of all, the normal vaginal discharge, it depends on the cycle. So now in the dry phase, where there's a non-fertile phase, it is usually very, very dry or a hint of moisture there. Now, the sticky phase, still we're not fertile at this time. This on day 4 to 6, could be just at the end of the periods or so. This could be whitey or cloudy in color, and it can form some kind of a sticky globs as well. Now, the creamy phase is before the ovulation, where it happens on day 7 to 9. And it can be cloudy, it's odorless, and some people do produce quite a lot of, abundance of it. And the clear phase is where we call it the window period, where it's the fertility phase. It looks like a raw egg white. All right, so these are normal stages of the changes that the vagina goes through because of the pH changes and also hormonal changes. Now, let's get into yeast infection. So this is a diagrammatic representation of how a yeast infection looks like. Usually, we describe it as curdy, white. Very rarely it has smell, and it can stick to the vagina and also the vulva, just like this first picture. Now, what we usually do is we take a high vaginal swab, like this swab over here, and we'll take a high vaginal swab and send this for microscopy. I'll show you just in a bit how it looks under the microscope. This is a real picture of how the vaginal discharge looks like for yeast infection, right? So it's a lot of itching here, and there's always redness and irritation, right? And we call it like a white cottage cheese-like vaginal discharge, all right? Now, as much as we hate to admit it, this is very common in many, many women. So about 70 to 75% of women actually do undergo or do experience this infection at least one time. Now, I'd like to explain that there is a few types, because I do have in my clinic many patients who come and they have it every time before their periods or after their periods. So now, an acute infection means that the infection is just one-off, it just started. And this is caused by Candida. This is also a fungus. And this Candida will be usually viewed under the microscope and also grown in culture. I'll just show you that in a bit. Recurrent candidiasis, recurrent yeast infection, would means at least 4 episodes in a year, right? And out of that 4 episodes, we need to have 2 times that we have confirmed that, yes, this is a candidiasis or a candida infection. Now, many times we wonder what we call it yeast infection. Actually, it's caused by a fungus, and it is not a sexually transmitted disease, so nothing, not much to worry about. It being sexually transmitted. It's caused by Candida albicans, but it can also occasionally be caused by other Candida species as well. And this is how Candida albicans looks like under the microscope. Right. So now Candida albicans and Candida per se is usually found in the vagina if and it doesn't cause any issues unless and otherwise our immune system is down, or for example, we're diabetic and the sugars are uncontrolled. Sometimes in pregnancy, because pregnancy is a state where there is some immunocompromise there. And also, it can be found in other places. So some people come in maybe with the start of a vaginal discharge, which is a yeast infection, and then they end up having a white coat on their tongue. So that's called an oral thrush, which is the same organism, which is the Candida albicans as well. Now, like I said, it can cause problems once the anything in the vagina, which means conditions that changes in the vagina, or anything in our immune system or systemically changes. So for example, hormones like in pregnancy, antibiotic use, because why? Because antibiotics actually kills the good flora, which means the good bacteria or the good fungus that is in the vagina. Now, when that happens, then that is an immunocompromised state. So when the immune system of the vagina is lowered down, then Candida can actually start causing problems for us. Hygiene is affected, like for example, in this kind of hot weather, we're wearing maybe very tight undergarments, or even not changing pads as frequent as we should have, or uncontrolled diabetes. Now, who is more common or more likely to get a yeast infection? We all are. However, there are some risk factors and some ways that we can prevent it. Right. So like I said, pregnancy, the weak immunity, and if we're taking any birth control pills, this falls under hormonal. And patients who are on birth control pills, be it for hormonal regulation or be it for even birth control per se, they actually do have a risk of getting yeast infection almost all the time after their periods. So hygiene and the other factors should be really monitored in these cases. Now, vaginal yeast infection, the symptom is very pathognomonic of it. So firstly, patients have the discharge, of course. So it's a thick white discharge, as we saw earlier, and it looks like a cottage cheese. And then it causes itching and irritation of the vulva, which is the skin outside, right? And also it later on leads to burning because of the scratching, and then the outer layer of the skin actually gets pulled off, right? And that relates to burning, especially when the patient goes to pee. Now, actually, yeast infection does not cause any odor unless it is really severe. However, a fishy odor is actually linked to something called bacterial vaginosis, which I'll be showing you in just a bit. Now, how do we make a diagnosis of the yeast infection? Like I said, there's 2 types, which is an acute and also a recurrent. So now the symptoms, as I told you before, and also after we take the sample from the vagina, and we see it under the microscope or the culture, and then we diagnose it as an acute candidiasis, or 4 episodes in a year, as I said, and 2 episodes, which is confirmed by the vaginal sample. This is called recurrent candidiasis. This is very important because recurrent candidiasis, the treatment is about 6 months, and the acute one is actually a one-off. All right. So this is how a high vaginal swab is taken. It looks like a cotton bud over here, and high vagina because right here is the cervix, and we take the swab just beneath that. So it's called the cervical-vaginal junction, and Candida is usually present there. Right? This is how Candida grows in the culture. Culture is where we take that swab and we put it onto this jelly-like substance. It's called the culture medium. And then usually the microbiologists would grow it for a few days to up to a week sometimes, and then they see where the Candida grows, and then they come up with the report. Under the microscope, it looks like this. It has hyphae, like this kind of tentacle-like projections, and also these rounded bodies under the microscope. Now, the report usually looks like this. This is a urine report. However, I'm just showing how roughly the report of a culture and sensitivity does look like. First of all, the first arrow here is Candida albicans. This is the thing that the organism that is seen under the microscope and is reported. And the most important part is the susceptibility profile. That is why we need to get the swabs done before taking any antibiotics, because when we take the over-the-counter antifungals and things like that, and when the doctor does do the swab for you, most of the time it will not show Candida anymore because it would have been treated. So normally your doctor would take the swab first and then treat it, and then see the report whether or not the Candida is resistant to any of the antifungal that we usually prescribe. And if the Candida is resistant, then we would be treating it differently with a higher grade of antifungal, right? So now the treatment, I always believe in prevention. So prevention is always better than the treatment first, right? So now, first of all, of course, keeping your skin dry and clean. Avoid using perfume, soaps, or wipes, even intimate perfumes. Control blood sugars if diabetic, right? Consuming probiotics. There are some probiotics which are vaginal probiotics as well, which actually help to accomplish the normal flora and the normal pH of the vagina. Avoiding tight panties, especially at night, and also having a healthy lifestyle. Okay, now as much as a lot of companies, a lot of pharmacies do sell washes and also panty liners, and also certain wipes that prevent the yeast infection, but so far there is no evidence of any of these measures to actually help with the yeast infection. Okay. Now, as I mentioned, the report is important because firstly, we need to see whether it is resistant or not resistant to the antibiotics. Now, let's see the first one over here. Here, there's an acute vulvovaginal candidiasis, right? So firstly, we'll treat it with the fluconazole, which is antifungal, right? And if not, then we'll treat with chlorotrimazole. This is usually given a lot in the GP practice as well. Now, recurrent vulvovaginal candidiasis. All right, so first we take the swab and see it under the microscope, and if that's confirmed, then of course the sensitivity will be done. Now, if it is susceptible to fluconazole, like most are, then we'll just give you some suppressive therapy 3 times a week and then continue it for 6 months. All right, weekly for 6 months, which means every 6 months for 1 week, you'll be taking the antifungal, right? And if it is resistant to fluconazole, then there's something called nystatin that will be prescribed for 14 nights, right? And the same thing, if certain candida is actually very resistant or doesn't have any treatment response at all to the first few treatment, then of course there is other things, more stronger antifungals, which are called azoles, as well as nystatin. Now, if they are actually resistant to azole or nystatin, then there would be more other higher end or higher grade treatments that will be prescribed by your gynecologist or your doctor. So now the other conditions are, like I said here, the bacterial vaginosis. So now bacterial vaginosis it actually can be transmitted via sexual intercourse as well, right? So now to diagnose bacterial vaginosis is this kind of a thick, abundant vaginal discharge, right? And sometimes it is grayish, sometimes it is white. In very long-standing cases, they turn green. And the presence of clue cells, this is the clue cell under the microscope. Now, the thing with bacterial vaginosis is the smell. Patients complain like, it smells of stinky fish. So it's called a fishy amine odor that is caused by this condition. Now, bacterial vaginosis usually is caused by a few types of bacteria, not just one. So it's caused by a few types of bacteria. So now, the treatment for it is usually, we would usually start with either metronidazole, which is an antifungal, twice daily for 5 to 7 days. This is an antifungal that it is usually only for bacterial vaginosis, right? Or if the patient, if just say, we are the type who always forgets, or we're worried about compliance, then normally a doctor would give you a single dose, which is a 2 grams single dose. Sometimes we can give intravaginal metronidazole as well, and this can be given once a day for 5 days. Or if patients cannot tolerate metronidazole, then we can always give the clindamycin cream. Okay. Now, what about in pregnancy and breastfeeding, as I mentioned? Okay, in breastfeeding, normally the vaginal area and the mucosa is usually dry because of the prolactin, but some women do have the discharge, right? So in pregnancy, of course, unless the patient is symptomatic, then we give the treatment. If not, then there is no need to start the treatment for vaginosis. Or if the patient has a risk of having a preterm birth, which means that maybe she had a preterm delivery before, or she had an infection in the previous pregnancy and then the baby delivered early, or the previous baby maybe was unwell, admitted to ICU because of any breathing conditions or infections, or maybe the previous pregnancy she had her water break really early. So that could be another cause of for us to treat early in the pregnancy.